What is cardiac output, or what is stroke volume, or what is minute volume? Cardiac output is expressed in two ways: stroke volume and minute volume. Stroke volume: the volume of blood that is ejected by each ventricle during each ventricular systole is known as stroke volume. So, realize this is the heart and ventricle, here ventricle 1, here ventricle 2. These two are ventricle. So when two type of systolic pressure and diastolic pressure, we know two type of pressure occur in this chamber. So this is auricle, this also auricle. So right, now stroke volume: the volume of blood that is ejected by each ventricle. This one is one ventricle, this is one ventricle. So this ventricle eject the blood, during each ventricular systole is known as stroke volume. Its volume is 70 ml in adult, and this systolic pressure ejected 70 ml blood in adult, and it is 47 ml per square meter surface of the body. So stroke volume index, that is the stroke volume index, 47 ml per square meter surface of the body, this blood ejected from the ventricle. Now to which minute volume: the volume of blood ejected by each ventricle per minute is known as minute volume. Here the minute, per minute ejection of blood from the ventricle. And stroke volume was the per systolic pressure ejecting the blood, and minute volume per minute the ventricle eject the blood, and its adult, and its volume is, in adult its volume is 5 liter and 3.2 liter per square meter of the body surface, says cardiac index. So 3.2 liter per square meter of the body surface it spread. The relationship between the two is expressed as minute volume is stroke volume into heart rate. Heart rate is the heart pump per minute. That is approximate 72 per minute. Now, question number 2. Mention the factor on which cardiac output depend. Mention the factor on which cardiac output depend. Mention the factor regulating cardiac output, or another question, mention the factor regulating cardiac output. Cardiac output depend on 4 physiological factors that are also called determinant of cardiac output. These are venous return, force of heartbeat, frequency of heartbeat, and peripheral resistance. venous return and stroke volume are directly proportional. Increase of force of contraction of heart also increase the cardiac output of stroke volume. No. Means on the factor regulating cardiac output. Hello? The increase of force, of contraction of heart also increase the cardiac output of stroke volume. If more contract of heart, then the more cardiac output or stroke volume. The stroke volume is inversely proportional to frequency of heartbeat. Frequency of heartbeat inversely proportional to stroke volume. However, it has been found that in case of moderate increase in the heartbeat, the minute volume either remain unaltered or increased, but in case of much increase in heartbeat, the minute volume is decreased. So this factor, the stroke volume, is inversely proportional to frequency of heartbeat. It has been found that a moderate increase in the heartbeat, minute volume either remain or unaltered or increase, but in case of much increase in the heartbeat, the minute volume is decreased. If peripheral resistance is increased, at first the stroke volume decrease. If peripheral resistance is increased, at first the stroke volume decrease, and after a few beats cardiac output become normal. Beside those, a number of factors can alter cardiac output. Excitement, last part of pregnancy, muscular activity, feeding, temperature, adrenaline, histamine, etc. increase the cardiac output. However, in case of heart disease, cardiac output is decreased. Such alteration occur due to alteration of the determinant of cardiac output. Okay. Now, how cardiac output is measured? How cardiac output is measured? Measurement of cardiac output. There are different procedures to measure the cardiac output. One of those is the Fick method. Measurement of cardiac output by Fick method. In 1870, Fick discovered this method. According to this principle, cardiac output can be determined from the arteriovenous oxygen consumption or CO2 output per unit time. Based on this principle, cardiac output is determined from the following data. So, principle, we observe that cardiac output can be determined from the arteriovenous oxygen consumption. Arteriovenous oxygen consumption. The more oxygen consumed by the artery to reduce the venous blood, or CO2 output per unit time, or expel the CO2 per unit time. Based on this principle, cardiac output is determined from the following data: oxygen consumption per minute at number 1, and oxygen content of arterial and mixed venous blood. The amount of oxygen present in the artery and mixed venous blood. For arterial blood, blood sample is taken from an artery and from the mixed venous blood, and blood sample is collected from the right arterium with the help of a catheter, and by this formula we calculate cardiac output, which is determined by ml per minute. This is the unit, ml per minute. Oxygen consumption in 1 minute. Artery oxygen consumed in 1 minute by difference in oxygen content per 100 ml of mixed venous blood and arterial blood. Difference in oxygen content per 100 ml of mixed venous blood and arterial blood into 100. We collect the data from by the help of catheter from the right arterium of heart and place in this formula, and we can be calculated how the cardiac output is measured. Okay, thank you.